Is a clicking joint always a problem? The answer is both yes and no. For those of you who don't know me, I am Dr. Sanyukta Srivastav, a TMD expert and a general dentist. A clicking sound in your temporomandibular joint may result from a structural incompatibility of articular surfaces inside the temporomandibular joint or from disc derangement disorders. The latter is the more common cause of clicking temporomandibular joint. The first and the most common question is, why do you click at all? You click most commonly when your disc is not at its correct position. Your disc is actually a dense fibrous connective tissue that occupies the space between your lower jaw and your upper jaw. It occupies the space between the condylar head and the articular fossa. So when this disc is not at its correct position, it may lie a little anteriorly or a little in front. So every time when you have to open your jaws, you actually have to cross and come to the proper position over the disc and then translate and open your mouth wide. Every time you cross the thick band of the disc, you click. And every time when you close back, you slide over the posterior thick band and you click again. That is why you may have an opening click and a closing click while opening and closing the jaws respectively. Is that a problem? Sound per se is not a problem at all. So when you open and you close the jaws and you jump over the posterior thick band of the disc and cause that clicking sound, that does not do any harm to you. If you have had clicking for a very long time and it doesn't give you any pain at all, you actually do not need any treatment, except you need physical self-regulation. That is, you should prefer to have a softer diet, smaller bites and slower chewing. You should work on stress reduction more than the average population, and you should restrict your mouth opening to a painless range. You should also keep your lips together and teeth apart at all times when you are not swallowing or masticating. Remember that clicking sound is not a problem, but if you have pain, then definitely you should go ahead and get treated by a TMD specialist or a TMJ specialist. Pain means that your retrodiscal tissues, that is, the tissues that attach the disc to the bones surrounding it, are not adapting well, and that is why you are having pain. It also means that you might progress to the second stage of degeneration, that is, you might progress to disc dislocation without reduction. In these cases, you should consult your TMJ or your TMD expert and get treated as soon as possible.